Hey guys, welcome to my channel. For those of you who are subscribed, welcome back. Today I'm going to be talking about what I pack in my nursing bag and some nursing essentials that every nurse needs. So if you like this video, please like and subscribe down below. So first of all, this is my bag that I take to work with me every day. It has my name stitched on it. So I love that. So I'm going to jump right into this. So I've been wanting to make this video for the past week. I've been on the floor for the past week. I don't know if you know, but I'm a new nurse. I just graduated in May, but I really didn't get down what I needed until now. So now I'm more of in a routine and I know what I need and don't need. At first I was taking stuff that I didn't need, forgetting stuff that I need. So now I have it down, and this stuff that I have here today is stuff that I take with me every day to work, and that I plan on taking with me every day to work because it's very important. So first of all, I have this water bottle that I got in orientation right here. I take this with me because I only get a 30-minute lunch, and other than that, I'm back and forth all day and I'm super thirsty and I don't really have time to go get myself anything to eat or drink. So I take this with me to stay hydrated because that's super important, especially during COVID when you're required to have your mask on all day. Your mouth gets really dry and you feel really dehydrated because you're constantly breathing in up under that mask. So I make sure I take that with me. I also like to bring like some type of candy with me because again, I only get a 30-minute lunch, so I'm hungry, y'all. I'm hungry all day. So for my snack, I just bring like, these are some hard caramel candies. Got these from Kroger's for like $2 or $3 and they last for a long time. They're not a lot of calories, so if you're worried about calories like me, they're only 70 calories for 3 pieces. So I keep these on deck so I have something to chew on during the day, because other than that, I'll starve. So moving on, of course, I have my stethoscope. I leave this in my bag. When I leave, I sanitize and put it back in my bag so I don't forget it. And let me move on to the more important stuff. So I am also a resident at my job because I'm new. I'm a new grad. You're automatically enrolled into the residency program. So they gave us this binder. It's our nursing orientation manual. So for the residency program, you're required to check off on skills, and it gives you paperwork to document like critical thinking opportunities, skill opportunities that you come across, just so they can make sure that you're gaining competency in the area that you work. So this binder is great with keeping up for that. I would recommend, if you are in a residency program, that you keep, if it doesn't come in a binder, put it in a binder, but whatever they give you, to take that with you so you can fill it out as you go, because if not, it's going to be a lot of paperwork on the end that you could have been filling out. Like, this is nothing for me to fill out my skills that I did for the day, or different situations that I end up in throughout my shift when I have it with me. There's also a spot in here for resources. So I like to use that for like my policy and procedures. If there's a policy that I have no idea how to do, I think it's a good habit to get in to print off the policy and keep it with you, because every preceptor teaches differently, and my preceptor is great. She's been nursing for like 25 years. But like I said, I'll be with her one day and the next day I may be with someone else who does that different. So you're in control of your license. So if it's something that you don't know how to do, you need to find the policy for that, which is available, should be available on your unit, and you can make a copy. I like to stick it in here in case I need it again, or if it comes up again, whatnot. There was an incident since I've started, and I'm only going into my second week, where a patient got hypoglycemic on me and I didn't know what to do. I mean, they tell you the basic, give them orange juice and recheck blood sugar, things like that. But there's a certain protocol that you have to do that you're responsible for completing when this happens on your unit. So I did end up getting through that. My preceptor helped me with that, and that was great. But I did go and look at that policy afterwards and print and put it in my binder. So next time that happens, I have that there to reference to. Or if I have a diabetic patient in the future and I'm not familiar with that, I can review it before that happens. I have that in there just in case, so I know what to do in the case that that does happen. Also for resources, what I also keep in my bag, which is super important, is this folder. It's just a blank folder, nothing special about it. I got it in orientation before I got on the floor. And I like to keep more resources in there. So you realize very quickly on that it's important that you collaborate with other units, other specialties. You might have a CT scan. You may need to consult wound care or what have it. And you need to be able to get in contact with them. And you don't want to be that person that's like, how do you contact wound care? How do I call down to respiratory therapy? You should have that information. I got it in orientation. If you don't, again, find it when you get there, copy it, print it off, and have it for yourself so you have that as a resource. Also in here, I printed off that hypoglycemic policy. I also have it in here, what I got on orientation. So it's for adult hypoglycemia, and it goes through like a checklist. Is the patient conscious? Yes, no. And it'll take you step by step of what you should do, you know, what Baptist's policy is, which is where I work, for a hypoglycemic patient. There's all type of stuff in here about Aurora in case somebody's on life support. When do you call them? And that whole jazz. There's stuff on sepsis in here. There's stuff on the electronic record of how to pull stuff up and view stuff that you may not know how to do. And a lot of times your preceptor may not know how to do it. They might go a roundabout way to get to something that you might be trained on orientation to do more proficiently or efficiently. So you want to keep that with you. How to administer blood, I have that in here. And just a lot of good stuff to have, what's needed for a valid consent form and all that. So when this stuff comes up, I don't necessarily have to ask a bunch of questions about it. I have that as a resource for myself. So I make sure I keep those with me at all times. Also, what I've learned to love is my clipboard. I keep this clipboard with me every day. Because what you'll find is, especially a handoff, and it sounds so simple, you're writing stuff down, you're writing stuff about your patient, and you have to go in the patient's room. So you don't want to have to keep folding up a piece of paper. You have to hand sanitize in and out. It's hard to do all that when you have a paper and all this. So I keep it on here. That way I can just tuck under here, Sandy in, you know, introduce myself, come back out, and I have it here again. And also have it throughout the day to carry with me to keep up with stuff. I keep blank papers on here. And every day when I leave, I take it and we have a shredder. So I put it in there and I shred it. So any patient information or whatever is getting disposed of correctly. So I would say a clipboard is very important. This one, so I had a smaller one that I left at work and I'm not sure what happened to it. So another coworker actually gave me this bigger one. So it's a little scratched up on the back, but it works great. The one that I bought was from Walmart. I think it was like $4 or $5. You can get a bigger one for maybe like $6. But get one because you're going to need it, and it's super important. It helps you stay organized, keep all your stuff in one area and whatnot. So along with the clipboard is this pouch. That's my leave. I'm going to start with that. Because of the mask, we're required to wear a mask all day. I figured out that it's because of this mask that I catch a headache almost every day that I'm at work. So I carry a leave with me because I've been at work with this headache, and there's nothing worse than trying to learn, you're new, and you have a headache. I mean, there's no way you can perform your best with a bad headache and it doesn't go away. And I feel like it's because of that mask, because everybody else complains of that since the requirement has been changed to having to have that mask on all day. So keep that with you just in case, even if it's not a headache, if it's cramps, if it's whatever you might need it for, keep that with you. I also have a surgical pair of scissors that I keep with me to change dressings or whatnot. I've always had scissors, but in nursing school, we really didn't need them. Whenever we went and did dressing changes at school, they were always provided, like in clinical and stuff, but you don't want to get in a patient's room and need to put a bandage on or take a dressing off and you don't have scissors. Now you have to call down and feel crazy. Like, can I have somebody bring me some scissors? Because they're annoyed and they're probably not going to bring them right away. So get in the habit of keeping you some scissors with you. I usually take these out of here in the morning and put them in my pocket on my scrub. So that's a good habit to get into. There's also pens in here and some dry erase markers. The dry erase markers are great for the care board. They keep some in the front, but they're always dried out or something, so I got my own. But just a tip there, being new, I'm trying to work on communicating with patients better. That's my weak area. I don't have prior experience doing healthcare. Like I said, I love to talk, but in a healthcare setting, it's a lot different. It's a lot more intimate. You're up close in person with somebody. You're discussing their health. You need private information and all that. So sometimes getting all that is overwhelming. So with the care board, I usually like to go in the morning, introduce myself, and write my name, my PCT's name, or some other places you might have a CNA that you work with, just so they're familiar with who's going to be caring for me today. Then after you go review their chart, you can go back and write down what their treatment plan is for today, any procedures or tests they have to get done. I like to write down their diet. I like to write down their activity level, like are they up ad lib, are they up with assistance, whatnot. So it's a reminder for them and it's a reminder for me. It also cuts back on questions from family. So it's a good way to communicate with family that may be in or out when you give information, so they know what's going on and they know what to expect throughout the day. So I love my dry erase markers. So that's what I keep in that pouch. And then I keep this planner. I just got this planner, but it's very important because so much stuff comes up, and I have a planner at home that hangs up on the wall. It's up there actually behind me. You just can't see it. It's on top of that, which is like our message board at home, so me and my husband can communicate stuff that's going on or whatever. But that's only for 1 month, then it's erased. So it's important, for at least for me, especially being in the residency program and we have a lot of stuff that's going on with that, to keep all my stuff organized. So this was only like $7 at Walmart. So this is I will recommend that you keep this. It's very important to you want to keep yourself organized as much as possible, especially for work and anything related to work, because you don't want your excuse to be you didn't know, you forgot, or whatever. And you get information in tidbits. Oh, I have a meeting here. I have to go here, this day. My supervisor might have told me this, but my preceptor might have told me this. So it's good to keep a planner with you so you can have all that in one spot. Okay, and lastly, one more thing that I make sure I keep in my work bag is my badge and my location device. So at our job, you wear this every day and it keeps up with where you're at. So it's important that you have this on you at all times. So one way to keep up with both of these is to leave them in your bag. When you get off work, just put them in your bag. So I like to do that. I like to stay in the habit of doing that. Also, so I have some disinfectant wipes here that I keep in the car. I don't necessarily keep these in my bag, but I think they're very important because, at least for me, I don't want to bring stuff home. I'm very paranoid about bringing stuff home. Got these from Dollar General. They were cheap. I forgot how much they were, but they were out of Lysol wipes, y'all, so I got these. But wipe your steering wheel off when you get in the car. Wipe it off when you get out. I share a car with my husband. I take my kids back and forth. We're in and out, people touching everything. You don't want to take some stuff home from work. If you're going to get sick, you don't want it to be from work. That's probably not going to be a good feeling if that happened. But other than that, these are the things that I take with me. I hope this helped you out and helps you better prepare for your job and make you more confident and make you able to feel a little bit more organized. So if you like this video, again, please hit subscribe below. Thank you guys for sitting here with me. I'm gonna edit that part out. And I hope you have a great day. Thank you. Bye.